Hi, my name is Wei Vern. I'm a STOTT Pilates Instructor and Physiotherapist. So today our topic is about lower back pain. It's a very wide topic that can be divided into a few aspects. So before we start, do remember to help us like, share and subscribe our channel for more videos like this in the future. And also don't hesitate to comment below if you have any question to ask. The usual affected area of lower back pain is what we call lumbar region of the spine. Lower back pain can be divided into two categories, which is specific lower back pain and non-specific lower back pain. Specific lower back pains are the one that happens with pathology such as nerve pain, disc protrusion, spinal fracture or cauda equina, and etc. However, our main topic today is non-specific lower back pain, which is also known as mechanical lower back pain that generally affects muscles, ligaments, and facet joints. It is often caused by direct trauma, heavy lifting inappropriately and repetitively, sitting in a poor posture for a long time, or frequently going into a poor posture. All of this strain might cause soreness and dull ache on your lower back area. If you have the condition described above, the following few simple exercises might help you. However, if the symptoms persist, do consult a professional. Enjoy the exercises with my colleague Crystal.
Thank you, Wei Vern, for your information. Hi everyone, I'm Crystal, a certified STOTT Pilates Instructor as well as a physiotherapist. I'll be showing you 5 exercises on the reformer to relieve the pain and discomfort on your lower back.
The first exercise is lift and lower. Starting position, pelvis in imprint position and reaching the legs away. Inhale, bringing my legs up. Exhale, reaching my legs away as far as imprint can be maintained. During this exercise, make sure you engage your core so that you don't arch your lower back. This exercise is good to mobilize your hip joint, at the same time strengthen your core muscles. The next exercise is knee stretch prep. Starting position, I'm testing my position by lifting my arms up. If your body didn't fall, that's the position that you want to go to. This exercise requires the rounding of the back and at the same time reaching your spine into a neutral position. Inhale, prepare. Exhale, you are going to round your back, initiating from the tailbone. Inhale to stay. Exhale, you are going to articulate back to the neutral, starting from the back again. So for this exercise, it requires your spinal articulation and connects your mind and body awareness on how your spine is moving. For this exercise, you have to make sure that as you come back to the neutral, you don't arch your low back. Throughout the exercise, make sure your pelvis stays in one place, not sitting back through the heels, and the crown, which is your head, is following the line of your spine, not collapsing down or looking too much forward. The next exercise is hip roll. Starting with my pelvis neutral on the reformer, heels on the bar. Inhale, prepare. Exhale, articulate my pelvis off the reformer. Inhale to stay. Exhale, straightening my knees to form a long line between my shoulders and my feet. Inhale, bend the knees to return. Exhale, articulate my spine down from the spine down to the pelvis. Inhale to prepare again and exhale to scoop. So for this position, you're making sure the carriage doesn't move. As you exhale, straightening your knees, only the carriage will start moving. Engaging your core, low back and your hamstring muscles, you are going to return the carriage and you slowly to articulate your spine down back to the pelvis. When you lower, make sure the pelvis is back to the neutral. This exercise, like I mentioned just now, it helps you to engage the core, low back and the hamstrings, which is essential to strengthen your low back. As you return back to the front, make sure your hip is always in an extended position. And when you lower down, make sure the reformer carriage has minimal or no movement. The next exercise is round back. I'm sitting on a short box on the reformer and feet underneath the strap. So when you sit, make sure the weight is on the sit bones, your pelvis is in the neutral and your shoulders is stacking up the pelvis. Inhale, I prepare. Exhale, I'm going to initiate from the pelvis to roll back. Inhale, reach my arms up. Exhale, round forward and inhale to come back up tall. As you sit, make sure you don't overarch your low back and you don't slouch like this. When you do the exercise, don't bring the shoulders to the ears. This will create the tensions in the shoulders. As you sit forward, make sure the weight is onto the sit bones, only you step back up to your starting position. This exercise is good to strengthen your core muscles, putting your spine in a round back position. At the same time, it can help you to articulate your spine in a lengthened position. The next exercise is twist. Sitting tall on the short box and feet underneath the strap, hands to the side. Inhale, I'm going to prepare. Exhale, turn to the right side for 3 breaths. Inhale, I'm coming back to the